This patient was referred to us for endodontic treatment of tooth number 30. Patient also has dental phobia, and her dentist referred her to us for endodontic treatment of tooth number 30. Patient, as I was interviewing the patient during the consultation visit, she kept telling me that the pain was kind of radiating, and she was also not sure if tooth number 30 was the source. But I mean, you look at tooth number 30 and you can see that there is a mesial recurrent decay approximating the pulp of the tooth. But as I always say, make sure your evaluation, your examination is thorough. So this patient wanted to, because she had just purchased a new insurance and her new insurance would kick in next year, she wanted to see if she could wait, but she was hurting. And she wanted to see if she could wait a few months, a couple of months. Today is 10/29/2024, so she wanted to see if she can wait 2 months. So I always tell the patient, you want to wait, that's fine, as long as you can endure the pain that you're experiencing. I'm not experiencing the pain, you're experiencing the pain, and I strongly recommend that you don't go on pain medication for 2 months. Pain medication has its own side effects and risks. Taking pain medication has a lot of risks associated with it as well. So patient said, okay, let's take a look and see what we have. And I'm looking at tooth number 30. Granted, tooth number 30 has a cavity here. As I said, recurrent decay here, approximating the pulp of the tooth. It was percussion palpation, all within normal limits. And I did a little bit of more looking around and take a look what I saw. This is tooth number 28. So number 30 would be here. This is tooth number 28. Look at tooth number 28. Look at that huge decay. Percussion tender, palpation tender. And so definitely, if patient wanted to treat a tooth on an emergency basis, it would probably be tooth number 28. And granted, tooth number 30 would need a root canal, but as I said, patient wanted to wait until next year. So tooth number 28 looks like is needs endodontic treatment more urgently than tooth number 30, because as I said, number 30 was granted there was recurrent decay approximating the pulp, but it was percussion palpation within normal limits. Tooth number 28, on the other hand, was percussion tender, and you can see the large buccal decay here. And let me show you the radiograph of tooth number 28. Take a look here. Again, that's tooth number 30 and recurrent decay there, but look at tooth number 28. So patient chose, because she couldn't handle the pain, and I recommended strongly against her taking pain medication for the next 2 months. Patient chose to go ahead and let us sedate her, IV sedate her, and do tooth number 28 right now, and then she'll come back in a couple of months for tooth number 30. We need to sedate her again for tooth number 30. I wish she had the finances so we could do both of them today, but she just had to choose between the two and chose root canal treatment of tooth number 28 for now. So that's what we did for her today. We went ahead and sedated her and did the root canal on tooth number 28, and take a look. So this was the my working length PA. As you can see, I had already removed the decay and rebuilt that buccal wall. And this was 21 millimeters right there, and I knew that I was short by 3 millimeters, so we corrected that, so the working length was 24 millimeters. Here is the post-op. As you can see, everything went beautifully. Look at that, beautiful, gorgeous, if I may say so, bifurcation in the apical area of the canal. So you can see everything went great. We went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. As I said, the next treatment next year will be tooth number 30. We're going to need to sedate her again and do that. As I said, I wish we could do both of them together today in one appointment, but due to finances and her insurance kicking in next year, she wanted to wait. So we'll do number 30 next year in 2 months, basically. But 28 is done. Excellent.